And we are back, everyone. The Boston Congress of Public Health is bringing you another interviewee, Dr. Barrak Alahmad. He is a 40 under 40 Public Health Catalyst Award winner for the inaugural cohort of 2022. And the inaugural cohort, as you may know, represents the next generation of leaders, entrepreneurs, researchers, scientists, activists, intellectual provocateurs, authors, and directors who are inspiring and catalyzing us to a more just and equitable world. So, welcome to the show, Barack.
Thank you, Candice. Happy to be here.
Absolutely. Oh, great. Happy to have you here. And so, tell us a little bit about where you're calling in from and where you are from originally, if that is multiple places in the country or what have you.
I'm calling in from Boston and in the middle of a heat wave actually right now. But it's interesting to say this because I am originally from Kuwait, and heat is very common in Kuwait. So I am kind of now adjusting between the heat here and the heat in Kuwait, that the one that I'm used to. So I am from Kuwait. I was born in Kuwait. I lived all my life. I went to school in Kuwait, primary school, and then high school. And then I went to the UK to do my medical school or medical training. And then after finishing about 6 years in the UK, I went back to Kuwait and I practiced as a physician. And then after that, I started my public health journey.
Sorry about that. Trying to unmute. So that's a very interesting journey. And so, how is it? What prompted you to go from Kuwait to Cambridge to now the States?
Yeah. So in Kuwait, when I was throughout my entire childhood, you would see environmental exposures all the time. I lived through dust storms and heat, and all of these things are really at another level of magnitude compared to anywhere else in the world. So you get all these questions in your mind, but I cornered these questions and went on with my life. Got a good grade at the school, at high school, and then I got a scholarship. I was so happy. I went to the UK and I started my journey at Liverpool Medical School. So when I was there, I was more focused on getting the medical training. So, and that all the training that we had throughout many hospitals there in the UK. And then after graduation, I was still very much convinced that I wanted to do internal medicine. I wanted to be a rheumatologist and maybe with some interest in diabetes sometimes. So I had all these ideas in my head. And then I went back to Kuwait to practice. Public health was not on my mind on that airplane when I came back from the UK to Kuwait. I wanted to be there, help the community, practice medicine exactly where I was from. But then, as I was practicing, we do like a junior year level at the time. So you do a year or two before you decide to what you want to do next after graduating medical school. So during that time is when I started to have questions, and the questions were like at a bigger scale rather than the individual level treating patients, I feel like. So it was more of an realization that for you to treat the population, you need to ask different questions that are at the population level rather than at the individual level. And as a practitioner, as a doctor, your only ability is to change someone who walks through the room. And you're in the treatment room, and then you treat one patient at a time. But then you have all these big questions. I was always interested in the environment and what effect does this have? So you try to connect the dots while you're practicing medicine. So I thought to myself, you know what, maybe I should just give this a go. Let's see if I really like doing public health. And so I went to the Department of Public Health and knocked on their door. I was like, hey, listen, I want to do a rotation here. And everyone said, oh, no, people usually do rotations in surgery. And and the specialties that they want to do. I was like, maybe this is a specialty that I want to do. Let me do a rotation with you. They welcomed me. So I spent probably, well, I did the rotation first, but then I loved being there in the Department of Public Health at the Ministry of Health in Kuwait. And I was like, oh, this is great. Let me just take this up one notch. And then I decided to apply for a master's of public health because I realized, well, I like doing this, but I have no skills in public health. I really enjoy what I'm doing, but I don't have any skills in that. So I needed to get some training and some skills. And then I applied for my Master of Public Health. I went to Johns Hopkins, Bloomberg School of Public Health. And it was an eye-opening journey when I started doing my master's. So I got exposed to all different aspects and perspectives of public health. And I loved it. I felt like this is what I wanted to do. And I focused more on environmental health. I focused more on risk assessment. I started to get more skills in public health. And then I took this and I said, yep, one more step. Let's get another public health degree under my belt. And I applied for a PhD. Until that time, I was, tiptoeing. Yeah, maybe I should go back. Maybe I should not go back. But then when I put the application together for a PhD, I knew I was going to do public health and quit the clinical medicine as you know it. And I did that. So I applied and I got a PhD scholarship from Harvard University. And I went there. 4 years went by really quick. I just graduated last May of this year.
Yes, congratulations. It's a very interesting journey, that you have, and it's, we've had a couple other physicians, on the show who have had a similar journey, and I'm just curious, in your experience, other physicians you've come across who are similar like you, where you said, you know what, clinical medicine isn't for me. I'm going to make that bigger impact, that larger contribution as a public health practitioner.
It's a very nervy decision. You're very nervous when you make this decision. It's not easy at all, and it's one of those situations where you always think the other side of the grass is greener. Like, you're practicing medicine, you love what you do, but you think, you know what, maybe if I just go to that field, it is more convenient for me, or is it better for me? And you start to have these alternatives. So I was hesitant. I was really hesitant about this. Am I really not going to see patients for the rest of my life? Am I okay with this? So you have to think about all these questions because you're making a career decision right here. But for me, it wasn't abrupt. It was more gradual. So I took like mini steps, if you like, until when I got to the decision that, I'm getting a PhD and then I'm moving on and doing public health for the rest of my life. This was an easier decision at that point when you're starting your PhD. But the journey before that is what determines this. So you have these conversations with people, like different people, and then you think, I don't know, is it better for me to be here or is it better for me to be there? You should try. And I wish I knew this when I was being very hesitant and not sure what I should do. But you should definitely go there, knock on doors, do something unusual if you want, and then just try.
Absolutely. And so my understanding is that your interest has been in elucidating, the effects of climate change on different types of populations in the Middle East, as well as the health of migrant workers. Tell us a little bit about your interest in the research and the work around that, and how that became a passion of yours.
Right. So Candace, we were just talking about this, that being from Kuwait and being from the Middle East, the environment means a different thing than people in other parts of the world. We interact with the environment more frequently because we have a very harsh desert environment, at least in the Arabian Peninsula countries like Kuwait, Saudi Arabia, Qatar, the Emirates, Bahrain, Oman, and Iraq as well. So our countries, they face a very substantial challenges when it comes to the environment, but the problem has always been that there is little research coming out from these regions, despite having extremes of exposures when it comes to the environment. So if you look at the IPCC report on the consensus of climate change and the physical science of climate change right now, and they would mention that, yeah, the Arabian Peninsula is going to witness a lot of heat, for example, but there isn't a lot of data coming from there. There isn't a lot of research coming from there. So that was my motivation. I am from the Middle East. I care about the population. I care about my community. So I was determined to study the effects of the environment and climate change on Middle Eastern populations. Because we have a unique population that is different, you cannot have risk estimates from, let's say, the United States and just apply them to other different countries in the world and then say, well, problem solved. Now I can know what is the burden of climate change. No, you have to do the local epidemiology, the local studies based on local data to get all these effects that can inform policy making, but also communicate with the public in the country. So I was determined to get data from, let's start with Kuwait. I am from Kuwait. I am working for the Ministry of Health. Let's try to get data from the Ministry of Health. So I was trying to get mortality data or hospital admissions data, trying to find what is there. I got to know people, and then when I obtained some parts of the, I started working, and it's like, okay, fine. Now I have something that can produce some effects. But the thing when I started to do my analyses and doing the results and understanding the effects, let's say for example heat on countries like Kuwait, you would notice right off the bat that there are two kind of separate populations living in the same country. There are socially disadvantaged migrant workers who are taking outdoor jobs and being more exposed to extreme temperatures as compared to others like the Kuwaiti citizens with high socioeconomic resources that can shield themselves from this kind of exposure. So here you start as a researcher in public health, see the effect being different between two subpopulations that they just live together, but they have different health outcomes. So you start to ask the big questions about what does social justice mean in the sphere of public health, how we can empower people who are doing work on social justice with information about health, because health is central to everything that we do. So that was the next part of my journey, that I started to dig more into this. Let's get to the bottom of this. Let's know the health inequalities when it comes to populations that are different. For example, as I just said, the migrant worker population is 60% of the population in Kuwait. So it is a huge proportion of the population that needs to be studied. And that's what we continue to do.
Very interesting. And as you were telling the story, I was thinking about, yes, what are the social justice issues, that you've uncovered with that? And I was curious about specifically what forms of health. I think your bio may have mentioned, like looking into say cardiac uh, differential outcomes for, say, those two different types of populations, the higher SES versus the lower SES. But what are some of the other areas, or is it just kind of a broad a number of things within health for the populations?
Well, the most eye-opening thing when it comes to social justice and health inequality was COVID-19. So yeah, we can talk about climate change, which is my favorite area to talk about, and health, and how this is essentially a climate justice issue because we have migrant workers doing jobs that involve extra time outdoor, which means more exposure to heat and then higher vulnerability in terms of their health. That's one part. And we have a bigger issue that was an eye opening that happened 2 years ago when COVID 19 happened. So, what we started to see, talking about health inequality, is that there are condensed areas that were by design by the government back in the day, that they had certain areas that are overpopulated by migrant workers. It resulted in very unhygienic accommodations and apartments lived by probably sometimes 10 people in the same apartment, if not even more. And that resulted in enhanced transmission of a respiratory virus. So it started to become a big problem for the individuals and also for the community as well, because now we're trying to deal with this new disease that is doing major outbreaks everywhere. But these clusters that are happening in areas that are unhygienic and has been unmaintained, and it has been crammed for so long and neglected, now it is becoming a problem. So it is eye opening, although the warning signs has always been there, but the government sometimes do not listen to the warning signs. Now we're seeing poor health outcomes when it comes to COVID-19 for migrant workers compared to Kuwaiti citizens, more transmission, and more excess deaths seen in this community compared to the Kuwaiti citizens.
I totally see that. And I just to segue a little bit, so you worked on different environmental health initiatives. How are those, I guess, different from what you've described?
So we worked on heat, we worked on dust storms. That was one of the areas of study that I did during my PhD, that we wanted to characterize exactly how much dust we get each year in countries like Kuwait and Qatar and Saudi Arabia and other countries in the Middle East. So we wanted to know the relationship between dust and health, but first we needed to know what are the exposures that we get, and the levels of dust. Kuwait sees a lot of dramatic dust storms every now and then. It is becoming more frequent. So we also wanted to know, why is it becoming more frequent? And again, who is being more vulnerable to exposures like air pollution and dust? And I know, Candice, that you guessed this right. It's also the people who have extended hours working outdoors, like construction, like hospitality and service. And these in countries like Kuwait are migrant workers. So it also, wherever you look at it, whatever exposure that we decide to choose, whether dust now, or was it heat, or was it COVID 19, we kind of see the same theme here.
Absolutely. And I'm curious from your perspective, what are some future projects that you want to work on?
So we're doing a couple of projects on future projections of climate change. So how do we see climate change being translated into additional deaths by the next decades? And how much warming are we going to get? So that is in terms of a local scale and a regional scale as well. So we're trying to work on something like that. We're also working on having heat standards for migrant workers. How much heat is allowed before workers need to stop working? How can we save lives when we do something like that? So we're also interested and doing work on that. And of course, I'm also interested in what you mentioned earlier about cardiovascular mortality and cardiovascular risks that are associated with climate change.
Mm, I love it. And one thing I feel that within public health is that the environmental aspect is not always as emphasized as say things such as maternal and child health or sexual and reproductive health. If there were certain things you could put on the agenda, since you have been in the states as well, the public health agenda, in the U.S., or in places in the Middle East, what would it be? What would those things be?
So it is, as a clinician, it is still very hard for me to talk to clinicians and convince them about the role of the environment. It is because most clinicians are kind of focused on very narrow individual modifiable risk factors, which has been hammered throughout the years. So let's take heart disease, for example. So clinicians did fantastic work over the years with interventions like stents and blood pressure control and all these trials and framing heart study and all these interventions that kept driving the overall global trend of cardiovascular mortality down each decade. This is an amazing work. But we might be missing the role of the environment here, and we should start to pay attention to what climate change is doing in terms of exacerbating these conditions. So we're having to put things on the agenda. Cardiovascular mortality, for example, is the leading cause of death globally, and it is even a bigger problem in low and middle income countries compared to Western countries. So we need to understand the effects that climate change might have on the leading causes of death. That includes heat, that includes air pollution, and all the other associated exposures that could come with this. Now, also on the other side, that I would like to talk about the occupational protections that need to be put to protect public health. So most of the workers now get exposed to different type of exposures, but climate change exposures for the workers, this also needs to be elaborated more. We need to study these effects more and put prevention controls in there to try to protect health and make a healthy working environment as well.
I love all those different things that you just delineated. And I was thinking about a topic that was in vogue a couple years ago. I don't think it's bounced around as much recently, but the idea of a chief public health officer for certain companies, and thinking about just what you said about occupational hazards. One, do you think a chief public health officer might be needed and say, to be able to monitor these potential occupational hazards, or do you think that's just something that should be left to say public health practitioners, I guess, throughout who are in think tanks or research organizations and not necessarily part and parcel of the organization itself?
It should be from all sorts of fields and disciplines. So whether by the employers themselves or the government or whoever is forcing any standards, it should come from everywhere, and it is not like we cannot think of one solution for climate change, and unfortunately for climate change we cannot come up with vaccines that have smart ways of getting around the immune system so we can solve some problem of like COVID-19, or part of the problem, I should say. But climate change is more difficult. It's multifaceted. It affects every part of our life. So we need to have all sorts of cooperation to work together towards having some solutions. But I'm more focused on protecting health in terms of climate change.
Absolutely. And so, just having another segue, if Barak, if you could describe a challenging moment in your life and or public health career, what would it be?
So I would go back and circle back, as I think this is important for people who are listening here, to think about what you want to achieve. And it's okay to be nervous when you're trying to change careers. And that happened to me. So that was the most challenging part. I was not sure if this is what I wanted to do. I was not sure if this is how I want to do it. And it was challenging on a personal level, on a professional level. You feel that you're not really having skills in either situations or in either career pathways, that you need to get trained in this or you need to get trained in that, and it becomes confusing. So you have to search deep inside yourself and think, what would be the thing that makes me going, that keeps me going? And in that, I decided to do public health and not clinical medicine. And for me, that was something challenging to achieve.
Absolutely. And so I would say, as a 40 under 40 Boston Congress of Public Health Catalyst Award winner, how's your life changed?
Well, I mean, this is an honor, to be honest. That I looked at all the other 40, 39, I should say, winners, and it's a great honor to be on this list. It gives you this motivation to keep going. It gives this recognition that is really nice, and that keeps your drive, right? So you want to be hungry all the time, and do the stuff that you really care about, like the social justice stuff, the public health interventions that could save lives, that could change the way that people interact with the environment, and these kind of things. It is really important, and I thank the 40 under 40 Boston Congress of Public Health for this award, and keeping us motivated.
That's absolutely one of the reasons why we designed and distributed this award. And so, last question to you: in the short term and in the long term, where do you think this cohort, the Public Health Catalyst Award winners, will go, as well as future cohorts?
Wow, the sky is the limit, really. Um, I look at all the achievements that have already been made by all these awardees, and I think uh, that this will be a tremendous group of public health leaders that would change many aspects of public health as we know it today.
That's great. And so, for everybody tuning in, thank you for listening. If you want to learn more about Barrak and everything that he's doing, please go to bcph.org at 40 under 40. And if you want to learn more about public health and or social justice issues, visit our journal at HPHR Journal, formerly known as the Harvard Public Health Review, at hphr.org. Once again, thank you so much, Barrak, for this interview.
Thank you, Candace.